This video is meant to test your knowledge of skeletal terminology. Of course, in the center of the note card is again a definition in which I'll give you several seconds to answer, and then I will give you the answer, clarify, and expand on that answer. So this is the indentation in a bone in which another structure fits. The answer is a fossa, the best example of a fossa being the glenoid fossa, which is a fossa located on the scapula that the humerus head attaches to or articulates with. This is a tunnel through a bone. The answer is a canal, and the best example of a canal is the external auditory meatus, which you find located in the temporal bone. It is basically within the auricle or the ear and before the tympanic membrane. This is a shallow convex or concave surface where bones articulate. The answer is a facet. And remember, a transverse costal facet is found in thoracic vertebrae. It is a very important characteristic of a thoracic vertebra because that is where the ribs articulate. So generally structures articulate with facets, and the transverse costal facet is a really good example. This is a narrow slit in a bone or between adjacent parts of a bone. The answer is a fissure, such as the superior orbital fissure in the sphenoid bone. This is a shallow pit. The fovea is a shallow pit, a good example being the fovea capitis, which is located on the head of the femur. If you see that fovea capitis, you are looking at a femur. It is a dead giveaway. This is the rounded end of a bone that articulates with another bone. The answer is a condyle. There are many condyles throughout our skull and our mandible, right? There's the mandibular condyle on the mandible. There's the occipital condyle that articulates with the vertebral column on the occipital bone. There are condyles on many of your limb bones. A type of bone that is longer than it is wide. The answer is a long bone. Here's a picture that depicts all the long bones in your body. There's the clavicle, the humerus, the radius, the ulna, your metacarpals and your phalanges, the femur, the tibia, the fibula, the metatarsals, and of course your toe phalanges. This is a hole in a bone. The answer is the foramen, and the best example of a foramen is the foramen magnum, which is the hole at the base of the skull where the spinal cord inserts and articulates with the occipital condyles. Other foramens would include the mental foramen on your mentalis, the obturator foramen in your pelvic bone, for instance. This is a long indentation along which a narrow structure travels. The answer is a sulcus, a good example being the costal groove of the ribs. This is a ridge or projection. The answer is a crest, a good example being the iliac crest of the pelvic bone, or the coxal or hip bone. A bone that is about as long than it is wide is box-shaped, for instance. The answer is a short bone, and some examples of a short bone are the carpals, the patella, which is your knee bone, and of course the foot equivalent of the carpals known as the tarsals. This is a round projection of a bone's epiphysis. The answer is a head. Best examples of a head are in both the humerus and the femur. The head of the humerus articulates with the glenoid fossa. The head of the femur articulates with the acetabulum. This is a small projection proximal to a condyle. The answer is an epicondyle. You can find both lateral and medial epicondyles on, for instance, a humerus. This is a bone that is flat, round, and found within a tendon. The answer is a sesamoid bone, the best example being the patella, or the knee bone. This is a rounded bone projection. The answer is a tubercle, or a tuberosity just being an extra large tubercle. The deltoid tuberosity located in the humerus is a really good example. There's also the tuberosity which of the spine of the scapula as well. It's just a roughened projection in essence. This is a sharp process. A spine. A spine is a sharp process. One example would be the scapular spine. And there's also, like I said, a roughened projection of the spine of the scapula is also called a tuberosity. A bone that is broad, flat, and thin. The answer is a flat bone. There are many flat bones throughout your body. The lacrimal bone, your nasal bone. The vomer is that separation between your nostrils. The parietal bone, the frontal, occipital, scapula, sternum, and ribs are all flat bones. This is an outgrowth of a bone. The answer is a protuberance. A good example of a protuberance is the external occipital protuberance at the very inferior side of the occipital bone. This is a very prominent bony projection. The answer is a process. You're probably really familiar with the spinous process and the transverse process of the vertebra, for instance. The spinous process goes posterior to the vertebra, and the transverse are out to the side. This is a large projection that's only found on a femur. The answer is the trochanter. Remember, there are both a lesser and greater trochanter on the femur. A bone that's shape does not fit into other classes. The answer is an irregular bone, such as your ethmoid, your palatin, your hyoid, your sphenoid, your temporal, your zygomatic, maxilla, mandible, the vertebra, including the sacrum and also the coccyx, are all irregular bones. This is a long, narrow ridge. The answer is a line, best example being the linea aspera on the femur.